All right. Good day, everyone. My name is Anthony Derencius. I'm a PA, a physician assistant at Pinnacle Clinical Research. I work there as both a provider and a sub-investigator. And I've worked in other facilities and places in both general and transplant hepatology. And we're going to talk a little bit about liver function tests or liver-associated enzymes and kind of demystifying them, or just kind of explaining my approach and how I think about them, specifically in the terms of fatty liver disease or metabolic dysfunction associated steatotic liver disease or steatohepatitis. So one question I get maybe is, how can you tell, or, what kind of workup would you do if you saw someone with elevated liver enzymes? And for the sake of knowledge, liver enzymes that we're referring to will be AST, ALT, the aspartate aminotransferase, the alanine aminotransferase. So these are markers of inflammation. So, just because you see them elevated or don't, that does prompt you a little bit differently on how you'd work it out. But no matter what, you want to make sure that, especially with patients with metabolic liver disease, is there other things that could be contributing to their liver health? So if they have high liver enzymes or elevated liver enzymes, you need to rule out other causes. If they have normal liver enzymes, that doesn't mean they don't have liver disease either. So it's kind of tricky. But if you speculate fatty liver disease, MASH, MASLD, you still want to order things like viral hepatitis panel or serologies, maybe some autoimmune liver enzymes, the smooth muscle antibody or antimitochondrial antibody. You want to make sure that, you're looking at a complete blood count, platelet count. You have other markers of maybe alcohol use that you can check, things like a PET level, or more rudimentary. You can look at things like the AST to ALT ratio. You can look at GGT or gamma glucotransferase level. You have options. Patients with fatty liver are usually asymptomatic, but you still would want to work up with getting things like, basic imaging of the liver, maybe a right upper quadrant or full abdominal ultrasound. And then, we'll talk a little bit about maybe non-invasive markers of fibrosis staging. Now, when you look at liver enzymes specifically, or a liver test, that's going to be on either a hepatic function panel or a complete metabolic panel, CMP. And there's other things that besides AST and ALT that you kind of want to look at as well. So your liver, true liver function tests are things like the albumin, the bilirubin, total bilirubin, direct bilirubin, maybe the protein. The other kind of liver enzyme that we'll talk about will be alkaline phosphatase. So these also all kind of give clues as to what could be going on with the liver. So if this is simply fatty liver or MASH, MASLD, ideally it's just minimal, maybe no more than 1 to 2 times the upper limit of an AST, ALT reference range. If you see an alkaline phosphatase that's abnormal, then you think of something maybe more cholestatic or some other secondary indirect cause of liver disease. GGT can be elevated in cholestatic diseases as well, or alcohol use, or just other really inflammatory liver conditions. But I don't generally expect to see anything else high if this is, again, just MASH or MASLD. If the function is off, if you have a low albumin level or a high bilirubin level, then you're thinking of something a little bit more severe and or maybe more advanced with that person's liver function truly. So this could be someone who now has cirrhosis or decompensation, or maybe they have some other major acute liver injury that, or even just a very severe presentation of some other chronic liver diseases. To differentiate, as I mentioned, MASH or MASLD, you don't expect very elevated liver enzymes like AST, ALT, ideally less than maybe 2 times upper limit normal. So if they are higher than that, I'm thinking of other etiologies or causes. So I would want to make sure I'm looking at all that and ruling it out. And of course, in conjunction with their medical history, if you have someone with very high liver enzymes, they don't really have the metabolic risk factors, you should kind of question in your mind if this is really just MASH or MASLD and not something more, or could it be more than one disease at once? And you can have fatty liver disease plus other causes like viral hepatitis, for example. Primary care versus a specialty care, it does change. So like in specialty care, we're going to do all these, these liver tests. Primary care may not, but even then looking at kind of the simple things, the hepatic function panel, the comprehensive metabolic panel, you can make some idea of this kind of thing. As time goes on, with liver, or maybe we should fast forward. So let's say, you now are pretty confident based on your liver enzymes that this is fatty liver disease. Can you, what would you expect with time as far as how these labs would fluctuate? So, if metabolic conditions are still ongoing and a problem, you're still going to see that the liver enzymes are not really going down very much. And just as fatty liver takes some time to improve, if you're doing things right, your liver enzymes will take some time to improve. But you expect kind of more gradual changes, both if things are getting worse or getting better, if we're talking about fatty liver. If you're seeing a lot of major fluctuations, normal to very high, or there's kind of this very abrupt increase, then you got to think there could be something on top of what the baseline liver disease. So it's just maybe medication or drug induced on top of what their liver injury is. Is there just some sort of acute viral issue, et cetera? So, liver enzymes, can really help guide you in a lot of things. They can confuse as well. So I think it's just a matter of understanding, the nature of each test and what it kind of denotes. When I talk to patients, though, if you have AST, ALT elevation, your liver is not happy, it's inflamed. We want to figure out why. And ultimately to treat, we would love to see that these enzymes are normalized, and then therefore you expect then the liver can start to truly heal. And if there's fibrosis, for it to regress. And there's fat, then that will resolve as well. But again, liver enzymes, if elevated, or if you suspect fatty liver, that's kind of an important minimal workup. Is going to be liver enzymes, some secondary liver tests, things for other chronic liver diseases, some imaging of your liver. Ultrasound is kind of the standard to look at the liver, and you should see findings of echogenicity or steatosis to signify fat. And then with liver enzymes, you can use that as part of calculations and things like a FIB-4 or a NAFLD fibrosis score, for example. You can also order at the same time maybe some proprietary liver biomarkers, things like an enhanced liver fibrosis score. And then this would prompt you, especially in specialty care, to kind of do the imaging-based, non-invasive testing, things like transient elastography, MR elastography, or even ultrasound elastography. And then ultimately, if you're in a kind of diagnostic conundrum, you're not sure why these liver tests are the way they are, you always can resort to the invasive manner of getting a liver biopsy, which still has some role and utility in the workup for fatty liver, abnormal liver enzymes, or otherwise. So overall, thank you for listening. I just want to extend my appreciation for everyone. And I definitely enjoyed talking about liver tests and liver in general. So hopefully you found this informative. Thank you so much.